Welcome to the Therapy Trainings Podcast, where we dive deep into the world of mental health, trauma, and effective therapeutic practices. Today's episode is a companion piece to the course titled 3 CE Hours Trauma-Informed Care, offered by Therapy Trainings. If you're a mental health professional, counselor, or therapist, or even just someone who's interested in understanding more about trauma-informed care, you're in for a treat. Throughout this episode, we'll explore what trauma-informed care really means, its core principles, and how it can transform the way we interact with clients. We'll highlight common misconceptions surrounding trauma-informed practices and provide actionable insights to implement in your everyday clinical work. So, grab your favorite beverage, settle in, and let's get started. First off, let's define trauma-informed care. At its core, trauma-informed care is an approach that recognizes the widespread impact of trauma on individuals, communities, and society as a whole. It's not just about understanding a client's trauma history. It's about integrating that understanding into every aspect of the care we provide. The goal is to create a safe environment where clients feel understood, respected, and empowered. One of the key principles of trauma-informed care is the emphasis on safety. When clients enter our therapeutic spaces, they should feel physically and emotionally safe. This might seem like a no-brainer, but think about it. How often do we consider the emotional safety of our clients when planning our sessions? Safety goes beyond just having a secure environment. It encompasses the way we communicate, the boundaries we set, and how we respond to our clients' needs. For instance, let's imagine a scenario. You have a client who has experienced significant trauma in their past. As they share their story with you, they might suddenly become anxious or withdrawn. A trauma-informed approach would encourage you to recognize these signs and adapt your response accordingly. Instead of pushing them to continue, you might pause, check in with them, and ask what they need in that moment. This simple act of prioritizing their emotional safety can make a world of difference in their therapeutic journey. Another vital principle of trauma-informed care is empowerment. This means recognizing that clients are experts in their own lives and experiences. It's about giving them a voice in their treatment and fostering an environment where they can regain control. It's tempting, especially for those of us with a wealth of knowledge and experience, to take the lead in therapy. But true empowerment involves collaborating with clients, setting goals together, and respecting their autonomy. Imagine you're working with a client who feels stuck in their progress. Instead of prescribing a solution, you could facilitate a conversation about what they believe is holding them back. By allowing them to lead the discussion, you not only empower them, but also create a deeper connection and trust in the therapeutic relationship. It's a win-win situation. Now, let's transition to another important aspect of trauma-informed care, understanding the pervasive effects of trauma. Trauma can manifest in various ways, from anxiety and depression to physical symptoms and relationship issues. As mental health professionals, it's crucial that we approach our clients with curiosity and compassion, recognizing that their behaviors may be coping mechanisms developed in response to their past experiences. For example, a client who struggles with trust issues may come across as defensive or guarded during sessions. Instead of labeling these behaviors as resistance or non-compliance, a trauma-informed perspective encourages us to consider the underlying trauma that may be influencing their actions. This shift in mindset can help us respond with empathy rather than frustration, allowing for a more productive therapeutic relationship. Let's address some common misconceptions about trauma-informed care. One major misconception is that it only applies to clients with diagnosed trauma-related disorders. In reality, trauma-informed care is relevant for all clients. We all have experiences that shape us, and while not everyone may have a history of trauma, the principles of safety, empowerment, and understanding are universal. Another misconception is that implementing trauma-informed care requires extensive training or resources that are often unavailable. While specialized training can certainly enhance our understanding, the core principles can be integrated into practice regardless of our prior knowledge. It's about being mindful of our approach and fostering an environment that prioritizes our clients' well-being. So, How can we start to incorporate these principles into our daily practice? First, begin by assessing your own biases and beliefs about trauma. Reflect on how your own experiences may be influencing your interactions with clients. This self-awareness is crucial for providing effective trauma-informed care. Next, create a welcoming and safe environment. This might include factors like comfortable seating, private spaces, and clear communication about session structure and confidentiality. But remember, it goes beyond the physical space. It's essential to establish relational safety by building trust and rapport with your clients. Another practical step is to incorporate trauma-informed language into your practice. This means using language that is non-judgmental and validating. For instance, instead of saying, "You need to stop being anxious," you could say, "I can see that you're feeling anxious," and that's completely understandable given what you've experienced. This subtle shift in language can have a profound impact on how clients perceive their experiences and themselves. As we wrap up this discussion, I want to leave you with some thought-provoking insights. Trauma-informed care is not just a set of techniques. It's a mindset. It invites us to see our clients as whole individuals with a rich tapestry of experiences rather than just symptoms or diagnoses. When we adopt this perspective, we not only enhance the therapeutic relationship, but also contribute to a more compassionate and understanding mental health landscape. Remember, it's about fostering resilience, promoting healing, and ultimately empowering our clients to reclaim their stories. If you're interested in diving deeper into these concepts, I encourage you to check out the course, 3 CE Hours Trauma-Informed Care at Therapy Trainings. It's a fantastic resource that will deepen your understanding and provide you with practical tools to enhance your practice. You can find more information at therapytrainings.com. Thank you for joining me today on the Therapy Trainings podcast. I hope you found this discussion on trauma-informed care illuminating and inspiring. Remember, every small change can lead to significant outcomes in the lives of our clients. Keep learning, keep growing, and keep making a difference. Until next time.